And joining us now from Capitol Hill is Republican Congressman Bill Cassidy from Louisiana, a doctor himself. Congressman, let me ask you about Senator Baucus's bill. I know it's on the other side in the other chamber, but, you know, the CBO says it's going to cover 94% of Americans, actually reduce costs over 10 years. So what's not to like about that from your perspective?
Savannah, there's a little bit of a sleight of hand as to how the CBO or how it was scored. For example, it will push Medicaid costs off to the states. So 10% of the additional cost of covering these folks by the Medicaid expansion will be covered by taxpayers, but it will be on a state income tax form, not a federal. Now, currently, states across the nation are either going bankrupt or having to raise taxes or cut services to cover Medicaid. And so that's one thing. Secondly, there's another sleight of hand as regards physician payments and hospital payments. It says that Medicare will increase it this coming year, but after that decrease them by 25%. Now, that's just not going to happen. At least the president is honest enough to say that, no, we're going to do a fix on this, and as it turns out, that fix cost $240 billion. By and large, Senator Baucus has moved that out of the CBO scoring for his bill. I think it's fiscal sleight of hand, not fiscal responsibility.
Do you agree with the insurance reforms? I think that one thing that all the 5 bills have in common is this getting rid of some of these insurance practices like pre-existing conditions, that kind of thing. Do you want those kinds of reforms? And if you do, will it be hard for you to vote against them because you don't like other aspects of health care reform?
Absolutely. We want the reforms so that somebody with a pre-existing condition is not eliminated from coverage or priced out of coverage. For the last 20 years, I've worked in a hospital for the uninsured. This is an issue near and dear to my heart. That said, any system you put in place has to be financially sustainable. Ultimately, if not, benefits are cut. Again, I work in a hospital for the uninsured. I can tell you from firsthand experience, when the state hit a problem with their financing, our hospital and therefore our patients lost service. So we have to have those reforms, but in a way which controls cost as well so we can sustain it going out into the future.
All right, Congressman, thank you so much for your time. Pleasure being with you today.
Thank you, Savannah.
Well, let's bring in Democratic strategist Peter Meridian and Republican strategist Trent Duffy. Hi, guys. As you know, the president met one-on-one with skeptical Democrats yesterday. He's got a Republican problem